Greetings from the University of Arizona Health Sciences in downtown Phoenix. Hope you are safe and well this evening. My name is Allison O'Toole, and I'm the Executive Director of Corporate and Community Relations, representing both of our medical schools here in Phoenix and Tucson, and the colleges of Pharmacy, Public Health, and Nursing.
And good evening, I'm Caroline Berger, Director of Corporate and Community Relations here in Phoenix. And we're joined this evening by Liz Kaplan, our Senior Director of Development, and she is off camera right now. We're staying at a safe distance, staying healthy and protecting ourselves. But we're so excited to be here with you this evening. We have a jam-packed agenda, so let's get started.
Let's get started, and I'm glad that you mentioned that. We are 6 feet apart, but we did come in with our masks on this evening. We just wanted to show you, and we took our masks off once we were properly seated. So safety is very important, so we're making sure we're being good role models this evening. So we're very excited to have you here. Thank you.
We are, and we're doing this as a virtual event, so that way you can be able to join us from the comfort of your home, but still and have the experience of being on our campus.
Yes, that's right. Well, Caroline, let's start our event off with a very special welcome from our Senior Vice President of Health Sciences, Dr. Michael Dake.
Good evening. I'm Mike Dake, Senior Vice President for the University of Arizona Health Sciences. Welcome to all of our health sciences friends and supporters in Phoenix. And thank you for joining us for what will not only be a glimpse into some of our health science programs, but also a chance to hear from some of our exceptional faculty, staff, and students who are making such a positive difference in the health and well-being of the local community. As you'll learn this evening, leading through health challenges like the COVID-19 pandemic is something the University of Arizona Health Sciences was built for, and we have found multiple ways to adapt and innovate. We developed one of the country's most accurate antibody tests and implemented comprehensive testing across the state for healthcare workers and first responders. We launched a two-way texting platform to help track COVID-19 and direct resources to families in need. We created thousands of coronavirus diagnostic testing kits for underserved areas of the state, including the Navajo Nation. And we leveraged our telemedicine program to help launch multiple telemedicine clinics across the state. Those are just a few of the ways we are helping the city of Phoenix and the state of Arizona through this crisis. This evening, you will learn more about our efforts taking place on our Phoenix Biomedical Campus from Dr. Guy Reed, the Dean of our College of Medicine there, as well as from Dr. Heather Carter, Arizona State Senator and Public Health Director at our Mel and Enid Zuckerman College of Public Health. I hope you enjoy this Wildcat Window virtual event, and thank you for your continued friendship and support.
Thank you so much, Dr. Dake, for kicking off our first ever virtual open house event. In addition to Dr. Guy Reed and Dr. Heather Carter that were mentioned in the video, we are also very excited to welcome our University of Arizona President, Dr. Robert Robbins, later on in the program this evening. We will also be joined by one of our exceptional students, medical student Abby Solorio, as well. So we hope you enjoy this interactive and fun experience. Please use the question and answer function, and feel free to leave any questions or comments that you have for us throughout the evening. And as we kick off this event, we wanted to share highlights and a virtual tour experience. Obviously, one thing we love to do, Caroline and I, is to host tours of the Phoenix Biomedical Campus and to show off this beautiful space. So we're hoping that we can do that with you virtually this evening. And I have to tell you that, the last 8 years that I've worked here, I've loved giving tours because I get to watch people, their eyes light up every time we take them to different places on campus. And so I get to fall back in love with the campus over and over again every time we give tours. But I also had a chance to experience this campus as a student for 2 years. So I graduated last year in the Eller Executive MBA program. And so I am so excited that I got to see this campus from a student perspective because it opened my eyes up to so many different things, and certainly the synergy and dynamic between the students and faculty here. So very excited, as you can tell, to be back home on campus tonight.
Yes, it is exciting. And as the 5th largest city in the nation, Phoenix boasts institutions of excellence in education, precision medicine, genomics, molecular medicine, cancer research, and much more. The Phoenix Biomedical Campus provides researchers, educators, and innovators unique opportunities to collaborate and to gain valuable insight. So now, sit back, enjoy, and we want to take you on a virtual tour of our campus.
Welcome to Phoenix Biomedical Campus, a vibrant place to transform, discover, and collaborate with 3 universities and bioscience partners. The Phoenix Biomedical Campus, or PBC, spans 30 acres providing researchers, educators, students, and clinicians unique opportunities to spark collaboration and growth in the biomedical industry. The PBC sits on the City of Phoenix-owned land and was established in 2004 by an initiative between the city, University of Arizona, Arizona State University, and the Arizona border regions to expand medical education and research in Phoenix. The University of Arizona College of Medicine Phoenix is the anchor of the campus. As a result of its high concentration of research scientists and physicians, the PBC has become a premier and dynamic location for biomedical research. The University of Arizona Health Sciences presence in Phoenix includes the medical school, nursing, pharmacy, and the Melanina Zuckerman College of Public Health. The University of Arizona's Eller College of Management is also on campus. The campus is the only site where you'll find all 3 Arizona's public universities in one location, conducting and collaborating in research. Additionally, NAU has close to 600 students on campus studying athletic training, occupational therapy, physical therapy, and physician's assistant programs. Also included on the campus is the Translational Genomics Research Institute, known for its groundbreaking research, Phoenix Union Bioscience High School, Arizona State University College of Health Solutions, University of Arizona Cancer Center at St. Joseph's, National Institute of Diabetes and Digestive and Kidney Diseases, and more. At full build-out, the Phoenix Biomedical Campus is anticipated to generate an economic impact of $2.1 billion annually. The Phoenix Biomedical Campus has come a long way since 2004 and boasts institutes of excellence in precision medicine, genomics, molecular medicine, cancer research, healthcare analytics, and others. Nowhere is this more concentrated than on the Phoenix Biomedical Campus.
Well, we hope this gives you a high-level overview of all the researchers, the programs, the innovative programs, the services, and even the resources that are available right here in downtown Phoenix. Now, of course, if you were with us on a proper tour, we would probably spend most of our time in the Center for Simulation and Innovation here on campus. It really is the crown jewel of the campus and a place where we can show off some of the toys and gadgets that we have here as well. So let's take a deeper dive and watch this video to highlight the Center for Simulation and Innovation.
Welcome to the Center for Simulation and Innovation. Our 5 procedural training rooms support over 25 procedures, ranging from introductory suturing to complex airway management. 4 of these rooms can accommodate 12 to 16 students, while our most spacious procedure room can host up to 100 students. This larger room is frequently transformed to meet a variety of educational scenarios. Our center is fully equipped with 14 simulated hospital rooms. Each room includes a functioning head wall, one-way glass, and cameras. Our mannequins can demonstrate variable chest rise, pupillary reactions, and heart, lung, and bowel sounds. Students can interact with the mannequin, asking questions about their patient's chief complaint and medical history, which realistically simulates a complete patient interaction. On the other side of the one-way glass, we have our control room. The simulation operator uses the mannequin software to change patient vitals or to act as the voice of the mannequin. Our clinicians observe the students and monitor their care of the patient. We do not pre-program scenarios, meaning the simulations are performed live in order to elevate the learning opportunities for students. In post-event debriefs, students gather with experienced clinicians and classmates. Our simulations are recorded to provide replay capabilities during debrief, which facilitates discussion of best practices in diagnosing and caring for patients, as well as improving communication skills. With medical technology rapidly advancing, our state-of-the-art simulation center is striving to excel, answering the needs of future healthcare providers.
This really is a remarkable place. And talk about community support. Also serves as a wonderful training ground for EMS and first responders, and is also a favorite for youth and students as they come into our campus and have an opportunity to see firsthand these very patient-like mannequins and simulators. So, and Allison, I see that we have a question from our audience. Thank you. What does the future look like for the Phoenix Biomedical Campus?
Well, the future is very bright for the Phoenix Biomedical Campus. And in fact, the building that we're in tonight, which is our Biosciences Partnership Research Building, is actually under construction right now. So we have multiple shelled floors in this building that are being built out right now. So we have more opportunity for laboratory and research space. And then just across the way, if you look out the windows here on the Phoenix Biomedical Campus, the Wexford Science and Technology Building, which is a partnership with ASU, and then also the Center for Entrepreneurial Innovation, that will be completed in October. And so this is the newest building on the Phoenix Biomedical Campus, which is important to mention. You can just imagine the increased synergy that will happen to have even more third-party researchers and innovators joining our campus. But don't worry, there's lots of multiple plots of land around this building for future programming for the University of Arizona.
Wonderful, wonderful. Well, thank you.
Sure.
Now it is my pleasure to introduce Dr. Guy Reed, Dean of the College of Medicine, Phoenix. Dr. Reed is an internationally recognized and renowned cardiologist, physician scientist, educator, and leader. As dean, he spearheads the college's proud tradition of excellence in advancing medical education, research, and clinical care in Arizona. But before we hear from Dean Reed, we would first like to talk a little bit about the medical school's Community Engagement Assessment Report, which really showcases the college's impact on the local Phoenix community. So let's watch.
A year ago, the first ever Community Engagement Assessment was launched by asking faculty, students, and staff to share all the ways the University of Arizona College of Medicine Phoenix interacts with our community. This comprehensive report documents the incredible work that demonstrates our medical school's unwavering commitment to improving our community's health. We served an astonishing 25,507 hours over the year in areas of public health, K-12 education, access to care, and pipeline programs. Our college community participated in 118 separate programs and projects across Metro Phoenix. Compassion displayed by our University of Arizona College of Medicine Phoenix community through this community engagement assessment is extraordinary, as there is no higher calling than committing to serve our community. Tremendous thanks for the hard work and dedication that is told through the hours that have been volunteered. Review the full report at phoenixmed.arizona.edu/CEA.
Wasn't that great? Now we would like to welcome Dean Reed.
Carolyn, thank you.
Good evening. Thank you for joining us this evening.
It is great to be with you and with Allison, and thanks for the great presentation you're doing so far. You know, our medical school exists to serve the people of Phoenix and the entire state of Arizona by producing extraordinary physician leaders and scientists who can treat and prevent and cure illness. Our students, our faculty, and staff care deeply about the health, well-being, and future of our community. That is why they have spent so many thousands of hours volunteering in service. This community engagement assessment shows the many contributions our college makes each year. But we also want to use this report to say thank you and to celebrate our college for this achievement.
That's wonderful. And we want everyone to know that we will be sending that report out to everyone who's attending this evening.
Yes, thank you so much. Great to see you, Dean Reed. And this is just remarkable. This is a very special place, and it is nice to have a report to be able to compile all of the data and figures for what we already knew, that community engagement is so important to us. Can you tell us a little bit about community engagement in terms of securing your top applicants that you want to come to the school? What's the connection with making sure that we have an outlet for our students to serve?
Yes, Allison, really good point. You know, our students are extraordinarily smart and competitive. They're in the top 10% of students in the country in terms of test scores. We receive about 80 applications for every position. But students are attractive to our college by our innovative personalized medical education, and as we have discussed here, the extraordinary culture of commitment to community service. This extraordinary culture of service is one reason we are successful at recruiting students to our College of Medicine here in Phoenix, even though many of them receive 3 or more acceptances to medical schools throughout the country. They choose to come here.
Well, that's remarkable. I mean, it really speaks volumes to who we are and, of course, the culture of the campus. And Dean Reed, we got a chance to see in the video a little bit about some of the community engagement work that's been happening at the medical school, but perhaps you could share some of the recent highlights that our students and faculty have been working on in terms of the COVID-19 pandemic.
You know, it's really been tremendous. Our students and our faculty have developed several innovative technologies and devices and approaches to reducing the spread of COVID-19. However, one of the things that we are most proud of is that our students organized a donation drive to support one of the hardest hit COVID-19 hotspots, the Navajo Nation. Here you can see that to honor Navajo veterans who served in the Korean War, U.S. Representative Greg Stanton, as well as the Korean Ministry of Patriots and Veterans Affairs, partnered to donate more than 10,000 N95 masks and 3.9 tons of supplies on Memorial Day weekend in collaboration with both our faculty and our students. Another extraordinary display of community spirit.
And that is wonderful. And we thank everyone for their involvement with that and for their support and dedication. Dean Reed, we have received a question from the audience asking to learn more about increasing the incoming medical school class from 80 to 100 students. Can you tell us a little bit more about this and how this will help achieve our diversity and inclusion goals as well?
Well, you know that Arizona has an enormous physician shortage in primary care and nearly all specialties. And to address this shortage, we are expanding our medical school to increase the number of physicians we produce each year. Arizona is a diverse community, and the Arizona of 2030 will be even more diverse than it is now. We must recruit and train doctors from diverse backgrounds who can better serve the patients of Arizona's future. As a new medical school with limited scholarship resources, though, it's sometimes difficult for us to offer students from disadvantaged backgrounds the opportunity to come to our college to become doctors. Our community can really help us recruit excellent, diverse future physicians by contributing to scholarships. These are really important for our underserved students when selecting medical schools to attend. You know, I have to say, all of our faculty, staff, students believe in this. They contribute to a scholarship fund to help under-resourced students, and I personally contribute to one as well. This is what really makes this a special place and a place where we can have a diverse student body.
Dean Reed, thank you so much for bringing that up. That's actually a great point and lead into my next question because you know, we have so many supporters that have joined us this evening. We know we are only here because of the support of our Phoenix community. Can you tell us a little bit more and expand on the role of philanthropy for our medical school?
Well, Allison, I think you started off really with an important point. We are so grateful for all of the support over many years to make this possible. Philanthropy is really vital to the success of our college, and the future of medicine is rapidly taking shape in our laboratories, classrooms, and centers. That's why gifts from individual donors, foundations, and businesses enable us to attract exceptional students and future doctors and faculty and maintain the state-of-the-art programs and facilities and build outstanding translational research to identify new cures and new treatments for our community.
Well, thank you so much, Dean Reed. This has been a wonderful experience for our first virtual open house guest. So thank you so much. We really appreciate you, and really thanks to your exceptional faculty, students, and staff who have just given so much to our community. So thank you so much, Dean Reed. And now I'm going to step away for just a moment, but I'm excited to have Caroline continue the conversation with our Senior Director of Development, Liz Kaplan.
Yes, we'd like to welcome Liz. And now is the opportunity for everyone who is attending. Liz is going to draw not one, but two names for some fabulous giveaways. Welcome.
Thank you, Caroline. It's great to be here tonight, and thank you, Allison. I want to thank also everyone for being here to this wonderful event tonight. To echo Dean Reed, you know, philanthropy is so important to the success of the College of Medicine Phoenix, and it really gives our donors and also everyone else a chance to really be involved in the shaping and the success and the future of our medical schools. So I'd like to really share some donor highlights, and I think this is really important for our audience to know tonight how wonderful our support has been with our partners and donors. We're proud to have $180,000 in educational scholarships that we gave away this year, support our work in rural communities, fund COVID-19 PPE, innovative solutions, and also in COVID research. Launch our inaugural Living Room Social Series, and support our annual White Coat Ceremony. So now to the fun stuff. I'm going to give first of our three giveaways tonight. I'm going to do two right now. We want to really thank our partners for tonight, our donors, Steak 44, Ocean 44, and Fox Restaurant Concepts. I want to give the first one to a $250 gift card to Steak 44, which is a beautiful steakhouse on 44th Street and Camelback Road.
Very nice.
Yep, and that person is Olivia Villasenor. I hope I said that name right.
Wonderful.
Yes.
Yay.
And
Congratulations.
Congratulations, Olivia. And then the second one is Joanne Ives. Joanne Ives, and you get a $100 gift card to Fox Restaurant Concepts, any Fox restaurant. So I will be back for our third giveaway, but thank you, Caroline, and thank you, everyone.
Thank you, Liz. Make sure you stay with us throughout the whole evening because Liz will be coming back with yet another great surprise. And thank you for those things. It all sounds very yummy. And thank you for our donors out there who are able to make such a difference in the lives of our students and our faculty and also our community. Now, I would like to introduce our next very special guest, Dr. Heather Carter. Dr. Carter is an assistant professor of practice in the Mel and Enid Zuckerman College of Public Health at the University of Arizona and the associate director of the Arizona Center for Rural Health. She has served in the Arizona legislature for the past 8 years, in the House of Representatives, where she chaired the House Health Committee for 6 years. Currently, she's the state senator from District 15 and is chair of Higher Education and Workforce Development Committee, also serves as vice chair of the Health and Human Services Committee, and sits on the Senate Appropriations Committee.
Well, before we hear directly from Senator Carter, I'm very excited to share a program with you called Street Medicine here at the University of Arizona, providing care and resources to those who may be experiencing homelessness. Senator Carter has been a vital supporter for our students and graduates who are running this program. So let's take a quick look at the video first, and then we'll have a chance to chat with Senator Carter.
Sounds good.
Yeah, I know a lot of people like coffee with cream and sugar, but if you can try to limit that, then that can make a huge impact as well. All right, is that too tight or are you okay? Okay. A lot of these folks have just fallen on hard times. They were very successful prior careers and families, and then for whatever reason, sickness or financial issues, they end up on the street.
Working with individuals experiencing homelessness, they have taught me that everyone matters. And then just relax your arm on the table. Take some nice, deep, slow breaths. Street Medicine Phoenix is a platform for building the next generation of healthcare professionals.
So it's interdisciplinary. So we have nursing students, social work students, pharmacy, ophthalmology or optometry, and then the medical students.
The students have learned all the basic skills and knowledge that they need to operate within Street Medicine Phoenix.
We're basically boots on the ground, so we have practical experience.
We provide a venue in which they have a lot of independence, so they can perform those skills and apply that knowledge to real-world patients.
The university also provides us our own storage unit so that we're able to kind of house all our medical supplies. So we take our glucometers, our test strips, we take a lot of over-the-counter meds.
No, nobody?
3, 2,
All right.
1.
Overall, I see someone that is coming to us, being vulnerable, wants and needs our help, and it's my job to listen so that I'm providing them the help that they need versus the help I think they need.
Just having like a very authentic conversation with the patients before, that's like not about their medical conditions or anything like that, just kind of getting to know them and develop that bond of trust.
And from being able to hear about their stories, being able to hear about their hardships, you realize that they're no different than you and I, and that each individual just needs a simple thing, which is care, support, and love.
Their professionalism, because they treat you like a human being, and they treat you like, you go to the doctor's office.
And it's about really empowering that next generation of healthcare providers to learn from the experiences that they're having within Street Medicine Phoenix.
Every time I watch that video, I am continually inspired by the founders, Justin and Jeffrey, who started Street Medicine. They just are the representation of what we think of health sciences. So Senator Carter, we are so excited to welcome you here with us this evening, and we would love to hear more about your role with Street Medicine and maybe give us a little glimpse of what we can expect in the future for this program. Welcome.
Well, thank you so much for having me tonight. And while we may be meeting virtually, it's an honor to see everybody and everybody for showing up tonight to learn more about what we're doing on the Phoenix Biomedical Campus. And what a way to kick off my portion of the conversation to highlight the work of Street Medicine. This is such an important program, and it really is a landmark opportunity for our students to have the experience to work collaboratively, not only within our own institution, across the colleges in health sciences, but between the Arizona Board of Regents universities, such as with Arizona State University, Northern Arizona University, and then with our private providers. So thank you for allowing us to show that video to everybody watching, because it's a story that we never tire hearing. And when we found ourselves in the middle of this pandemic, as we would expect, Street Medicine stepped up and really did everything they could to provide healthcare and needs and services to not only individuals who may be experiencing homelessness, but really rolling up their sleeves and trying to address the COVID-19 situation we have across the state of Arizona. So I just want to read a couple things that Street Medicine has been involved with. And as part of the original work from the Phoenix Mobile Health Unit, they were able to travel across the state of Arizona. For example, they spent the first week of June up in Flagstaff. And you may have heard in the news, the University of Arizona rolled out an antibody test, really the first in its nation, across the state, prioritizing an antibody test for our first responders and our healthcare workers. And it was the Phoenix Mobile Health Unit and the individuals that work with Street Medicine that traveled to Flagstaff and launched that program in the northern part of Arizona. And they did that in partnership with the Department of Health Services and with funding from the governor's office. So that is really a collaborative example of the work that they do on a regular basis. The College of Public Health specifically has received a telehealth grant, and through the mobile health unit, They are working in partnership with some of our federally qualified health centers, and they are working in partnership in Phoenix and in Tucson to make sure that we have the resources deployed to provide telehealth services to our communities through our federally qualified health center. And then also they have partnered with the telemedicine program we have at the University of Arizona, telehealth, with Dr. Weinstein, to provide devices to elderly who may not have the resources at home to connect to telehealth. As we know, many people, if they were still in need of medical care, everything was shifted from the office to a telehealth service. And that was extremely difficult to scale up as quick as we needed to. And that's what we did as a community to make sure that we were providing services to not only to those in Arizona, or in Phoenix, but across Arizona. And then a couple of other highlights. The Street Medicine Phoenix program receives donations from a number of resources. So I just wanted to highlight a couple. They received 10,000 socks from Bombas. And they've received everything from hygiene kits, feminine hygiene products, gloves, masks, gowns, both from local agencies, and then also sharing those resources across the state. As you heard, some of our tribal nations, specifically the Navajo Nation, were hit particularly hard, and making sure that we are using the resources across the state. And just a shout out to the BHHS Legacy Foundation, where the Street Medicine Phoenix program has been able to collect school supplies, and they'll be working with the UMOM Center in downtown Phoenix to distribute those as our families start to prepare to return back to school. So that's just, right off the top of our head, trying to collect some information for tonight's conversation. There's so much more work that needs to be done, and Street Medicine Phoenix and the Phoenix Mobile Health Unit and the College of Public Health and all of the colleges under Health Sciences at the University of Arizona are ready and willing to serve the citizens of Arizona.
I'm so glad that you took the time to kind of spell that out for us, because I feel like even in the last 4 months, I've learned so much about street medicine and the College of Public Health in terms of ways that we're able to serve our community. So thank you so much for kind of breaking that down for us to understand. And then Senator Carter, if we could switch gears for just a second. So much of your work focuses on rural health, and I thought it would be helpful for you to maybe outline why this is such an important area of focus for us.
Well, if you look at the situation in Arizona and you take a particular focus in rural Arizona, you see that many of the concerns that we experience in healthcare about delivering services to our citizens that live in rural Arizona were just exasperated during the COVID-19 situation. So the Center for Rural Health has worked relentlessly to support our partners across the state. Everything from helping them roll out the antibody testing to the frontline workers in rural communities, to receiving a grant from HRSA. We received $1.3 million that went to direct cash payments to 16 rural hospitals across the state. So this is an example of how we're trying to support our communities across Arizona to make sure that they have the services and the resources that they need. And really, the next step in this process is to continue to support our rural partners and our urban partners to make sure that they have the supplies that they may need, whether it be PPE, access to testing, and so forth. But also, we've talked a lot about testing. I want to just spend a few minutes and talk about contact tracing. So our College of Public Health, specifically out of the Phoenix campus, has worked with Maricopa Health Department to launch a contact tracing program and provide a training for the new contact tracers that will be deployed in Maricopa County. But the good news is this is such an innovative program that we are now reaching out to all of the counties across the state of Arizona, and this will be used as a model across the state. And even better for our students, they're graduating during unprecedented times. And specifically in Maricopa, they are hiring our Phoenix graduates to do this important work. So very exciting for our students. And I just want to say thank you to the faculty that helped build this program, and to the number of faculty who've taken calls from reporters and from a variety of resources to just provide data-driven decision-making for what we are doing as a state. Our faculty have really stepped up to the plate, and I'm honored to be part of it.
Thank you so much, Senator Carter. You're right. And we also say thank you because they've been a tad bit busy the last 4 months, to say the least. But thank you so much for your time and for all that you're doing for us as well, Senator Carter. We really appreciate it.
My pleasure.
We're so fortunate to have the College of Public Health obviously here in Arizona serving the needs of the state. We're also thankful obviously for Senator Carter and then also for the leadership of Dan Dirksen at the University of Arizona Health Sciences to meet the needs for our state. So switching gears a little bit, and Senator Carter mentioned this, you know, the students and them graduating and training during this time is a very unique period. And whenever we have a tour on this campus, we always end the tour by saying, you know, we're so glad that you came to this campus to see this beautiful place, but you haven't really experienced the campus until you've experienced having a conversation with one of our students, because then you're really able to see and understand the mission of what we're doing here at the University of Arizona. And so we're very excited to introduce you all to one of our medical students this evening, Abby Solorio. She's joining us actually down the hall, socially distanced. Abby, welcome. We're so glad that you're here.
Thank you, Allison. I'm happy to be here.
So Abby, we love to hear your story about growing up in Phoenix, and maybe you could tell us a little bit about who you are, but then also your dreams of becoming a physician as well.
Thank you. Again, thank you so much for having me. I really just appreciate the opportunity to share a little bit about my story and also my work with the community. My name is Abigail Solorio, and I'm now a second-year medical student here at the University of Arizona College of Medicine, Phoenix. And it still feels so surreal every time I say that, just because I think back to when I literally dreamed about being in the position that I am today. I was born and raised in Phoenix, Arizona, in an underserved area. And that's really where I witnessed firsthand the healthcare disparities. But I was always really drawn to medicine with the intent that I'd be able to give back to the community that I was raised in. Growing up in Arizona, it had been literally my goal to go to the University of Arizona in Tucson. As a first-generation college student, I just wasn't sure what that pathway would look like for me. And as a minority in medicine, I knew that I'd probably encounter some challenges along the way. But with the support of my family and my mom always encouraging me that if this is what I wanted to do, then we'd find a way to do it. And there's always going to be a way. That's really what kept me going. I attended North High School, which is actually right down the street from our campus now in Central Phoenix. And I remember driving to school and passing through downtown, and I would see the college expanding its campus and just kind of hope that one day I'd be able to continue my education here. And I remember it was really special to see like the U of A logo and the lettering on the building. It just really solidified for me that this is where I wanted to be. So needless to say, from the day of my white coat ceremony until now, this journey has just been nothing short of a dream come true for me. After that, I went on to attend the University of Arizona in Tucson, and I graduated with a Bachelor's of Science in Neuroscience and Cognitive Science, and then minors in Physiology and Psychology. After that, I was accepted into the Pathways Scholars Program here at UAComp. And I graduated with a Master's of Medical Studies in 2019 and then matriculated into the College of Medicine. So now as a medical student, I try to keep myself as busy as possible. I'm enrolled in the Service and Community Health Certificate of Distinction, and that's where I really focus a lot of my time working with our clinical and community partners. Most recently, we've been working with Wesley Health Center to reach out to Spanish-speaking patients who are a little bit more vulnerable during this time and just inquire about any challenges they've faced and any way that we can help them during this pandemic. So that's been really, really exciting. And then also always engaging with the youth. It's one of my passions. I try to work with them through educational programs and just any chance I get to allow them to explore different careers in STEM. So I also serve on the committee for our Office of Diversity and Inclusion, and I'm president of our Latino Medical Student Association here on campus. So I advocate for cultural competency and recently have been developing a medical Spanish curriculum. So I just feel really fortunate every day to have found a school that not only believes in my passion, but has given me all the tools that I need to succeed in this career. So really thankful for the opportunities and for those that have invested in my education. It means a lot to know that I have the community support in that way.
Well, that is wonderful, Abby. Thank you so much. And thank you for being such a great champion for us. Can you tell us a little bit about your scholarly project, which is something very unique to the College of Medicine here in Phoenix?
Yes, so my scholarly project focuses on understanding the experiences and also investigating the disparities that are prevalent within the Hispanic community, particularly assessing the barriers for children who are on the autism spectrum. So really my goal is to address these disparities and ensure that there is early detection and timely therapeutic interventions, as well as adequate care moving forward. And just a little bit of background, there are ethnic disparities that remain really prevalent, and Hispanic children continue to be disproportionately diagnosed at a later age, despite having similar clinical presentations as children from other backgrounds. And so given that the early therapeutic interventions are really crucial for a child's development, consequently, those who are diagnosed later in life are going to face greater challenges. So my personal study will be looking at several different factors, including the diagnostic process, patient experience, and social determinants of health and how this might contribute to such disparities. So I created a survey that's available in English and Spanish in print and online, and I'm going to use that to conduct this research statewide. But I just wanted to say that this vision and this entire research was really inspired by somebody who's very special to me and my cousin who has autism, but whose story is what inspired me into this journey, into a career in medicine. So I just kind of think about how kind and how big his heart is, and that's what reminds me to care for others with compassion and patience, and how determined and how strong he is, and that's what keeps me moving forward. So I've made it my mission now to advocate for vulnerable populations, and I just hope to bring awareness to the issues that these families are facing when it comes to trying to provide the best care for their child.
That's fantastic, Abby. We're all, cheering you on over here, and we're just so excited to watch you in your medical school journey. And we also want to offer congratulations to you as well, because you were one of the honorees for our Primary Care Scholarship Award. Would you like to wrap up your final thoughts by telling a little bit more about what this award means?
Yeah. So I was awarded the Primary Care Scholarship, which means that my tuition will be paid for throughout medical school. And in exchange, I will commit to practicing primary care in an underserved community. So for me, I just feel so grateful to continue my education. And this is kind of the culmination of so many different things, but really a future in primary care is so exciting because I get to work alongside my patients and empower them to take control of their lives and their health, and just recognize that every patient has a story to tell that's unique to them, just like mine. I hope to bring my personal background as a Hispanic female who's bilingual, who grew up socioeconomically disadvantaged, and just allow that to develop into a deeper connection with my patients. So it's such an honor and a privilege to practice medicine, and I'm so humbled that it's a passion of mine. And the scholarship is just so meaningful to me because I feel the support of my community, and I know that our community needs a lot of healing in more ways than one. So I remain really optimistic about closing that gap between what is and what can be, and just continuing to use my voice to advocate for my patients.
That is wonderful. Thank you so much, Abby. You were so inspiring. Congratulations on all that you have done. Best wishes for the coming school year, and bear down.
And also we have to say thank you to Senator Carter. This is a full circle moment because she was primary one of the reasons why we were able to offer those scholarships. So thank you again to Senator Carter for your continued support in so many different areas at the University of Arizona. Well, now we've come to an exciting part of our program this evening where we have the opportunity to welcome our University of Arizona president, Dr. Robert Robbins, to join us this evening.
Thank you, Allison. It's a pleasure to be with everyone this evening. And I agree with you. I appreciate being included in this evening, but want to thank Dean Reed for all of his leadership and vision for the College of Medicine in Phoenix, and also Senator Carter for all that she does, including being a faculty member at the U of A. But I agree with Allison. This scholarship opportunity for medical students to serve the state of Arizona could not have happened without Senator Carter's incredible support and passion. So Senator Carter, thank you once again.
Absolutely. We're cheering her on all the way over here in Phoenix. Absolutely. Well, President Robbins, we have just been had a front row seat to watching you the last few months. You've been on numerous national talk shows, and we just were curious, what has the vantage point been like for you managing through this pandemic and getting us to where we're at today?
Well, Allison, watching our extraordinary faculty, staff, and students is a tremendous source of pride for all of us. For instance, our nursing students are fighting on the front lines of COVID-19 in Arizona and other places that have been hit particularly hard by this pandemic, like the Navajo Nation, and students have gone as far as Washington State. Our incredible College of Public Health has been just tremendous asset to not only our students and our U of A community, but to Southern Arizona, Maricopa County, and the entire state. Has mobilized their primary prevention health unit program, for instance. This program allows our public health college to continue their mission of outreach to Spanish-speaking communities in Arizona, largely by phone, but this outreach has been so meaningful and has helped so many people over these last several months. Interestingly, there's a researcher at the College of Pharmacy that has identified 4 compounds that block the viral replication cycle of SARS-CoV-2 that causes COVID-19. Providing a promising starting point for future developments and future treatments to this devastating disease. I early on had the opportunity to be at the dedication of the pharmacy building in Tucson and heard this gentleman present his work. He's been working on coronavirus for over 20 years, and to see that there are potential therapeutic solutions to this disease is incredibly inspiring, and that the U of A could have some part in that. There are hundreds of other examples I could share about how we've responded to our community, and I'm just so proud to be a small part of this Wildcat spirit of service that all of us at the University of Arizona are so proud of.
That's wonderful. President Robbins, a few months back, you shared the stage at a Phoenix Chamber event along with President Crow from ASU and President Cheng from NAU, where all 3 of you discussed the importance of the Phoenix Biomedical Campus and what a unique place this really is. Can you share with us the motivation from the 3 presidents and how to work together and create a shared campus?
Yeah, Caroline, that's a really good question. I enjoy those times that we get to come together at the museum and share our ideas for the community about how we work together. The Phoenix Biomedical Campus is obviously a place where we spend a lot of time thinking about our collective mission, but we do it in so many ways across the entire state. So the Phoenix Biomedical Campus makes sense for a space where our 3 faculties can have dual appointments, for instance. We have U of A faculty that teach not only at the medical school, but also in NAU's physician assistant program is just an example. We've also made a commitment to interprofessional education, exposing our students to other allied health professions so that they have a more well-rounded training and experience that they would get. And I think this is so important because as many people know, the practice of medicine is not just about physicians. I always said at our internationally recognized transplant program at Stanford, the nurses really were the frontline heroes, but we had many others, respiratory therapists, psychologists, psychiatrists, infectious disease physicians that helped us to provide care. And I think given the opportunity of having all three universities co-located on the Phoenix Biomedical Campus is really accretive to all three of our missions. So these goals are achieved on the biomedical campus, and this synergy, I think, is very attractive to prospective students. I'll add one last thing. Through ABOR and with the three universities working together, we finally have an offer out, and hopefully we'll be announcing a new director of the Phoenix Biomedical Campus that will do that in coordination and on behalf of all three of the universities.
That is very exciting. And President Robbins, along with the Phoenix Biomedical Campus, can you tell us a little bit more about the programs happening in Phoenix?
Absolutely. Beyond the PBC, we're also venturing out to other cities as well. In the fall of 2019, our College of Nursing launched a new Bachelor of Science in Nursing integrative health program in Gilbert. And it was the first of its kind in the nation, which is very distinctive and I think very innovative. Even in the short time since that launch, the East Valley community is already asking for more U of A programs, and we've been welcomed with open arms and are listening to the needs of the East Valley. Just announced last week, the Eller College of Management launched a new professional MBA program in partnership with the Chandler Economic Development Department, also in the East Valley. And finally, I have to share our Cooperative Extension Office location, which is in the heart of Phoenix and is a vital asset to Maricopa County. Certainly, Cooperative Extension and our land grant mission to serve every county and all aspects of the great state of Arizona is something that sets us apart from our sister institutions. And with more than 70 amazing staff, these leaders are the backbone to everything surrounding healthy eating, K through 12 nutritional curriculum, 4-H programs, master gardener programs, juvenile detention gardens. It's incredible to learn the work that they are doing. And every day I learn something more special and exciting about the great people that make the University of Arizona and what they're doing. Our cooperative extension offices continue to work with the University of Arizona Health Sciences to ensure collaboration of resources. So I think not only agriculture, but our new College of Veterinary Medicine is also important in this equation because the One Health idea across the state using veterinary medicine, human medicine, nursing, pharmacy, public health, and agriculture, I think is a tremendous asset to the state of Arizona.
We couldn't agree more. You're absolutely right, President Robbins. And as you know, for Caroline and I, our role is to create a bridge from the University of Arizona out to our community members. And so wrapping up our final thoughts this evening, what are some things that you think are important to share? What's a message that you think is important to share with our community members tonight?
Well, there's so many. I think I was only given about 8 or 10 minutes, and as usual, I kind of outrun my coverage. So there's hours worth of things that I could share, because even in this pandemic, I've seen a spirit of cooperation and determination and resilience from our students, our faculty, and our staff, not only to just survive, but to thrive in this pandemic. And I'm so proud to be a part of this. But Connect to STEM is a great example of the largest STEM outreach event in Phoenix. And it takes place on the Phoenix Biomedical campus with over 30 University of Arizona colleges and departments showcasing the wonders of STEM to inspire the next generation of pharmacists, doctors, researchers, engineers, nurses, and public health officials. And by the way, the number of individuals interested in a career in public health, not surprisingly, is astronomically up. This one-day event, though, has reached more than 40,000 youth and their families over the past 6 years. We open our doors so that youth can meet a medical or pharmacy student, see the inside of the biomedical campus. As Abigail was saying, you know, she rode by frequently and aspired to attend medical school on the Phoenix Biomedical campus. So the earlier we can capture the imagination of these young students, I think the better the opportunity we're going to have to get them into one of these STEM programs. And of course, the health sciences are very, very important to the future of the state of Arizona and to the University of Arizona. These experiences are transformative for these children, their parents, their teachers that attend each year. Just the idea, planting the seed that you can get there. I mean, I wish I'd have had that growing up in the little town I had. I could have never imagined only, 100 miles away from where I grew up, I could have ever gone to medical school. But having this event opens everyone's eyes to that possibility, that aspirational goal. And this amazing event would not be possible without our corporate partners like Banner Health, our clinical partners, Cox Communication, and of course, the city of Phoenix. It's important to share this information because we want our community members to know our mission goes much farther beyond just training our students. As part of our land grant mission, as I said before, our goal is to serve each and every community of this great state of Arizona, and we're doing just that.
Well, thank you so much, President Robbins. Aaron Sheets-Freiberger and I can say that Connect to STEM is a labor of love, but it's something we love to do.
Good.
Thank you so much for joining us this evening for our very first virtual open house, President Robbins. We appreciate you very much. And I think we're going to end our evening with one final giveaway, which is a great way to end this fantastic night.
It is. We're going to welcome Liz back one more time for another giveaway from a wonderful gift card to Oceans 44. She's going to pick our final winner, and we know you're out there, so feel free to jump out and cheer. We'll cheer with you as Liz picks the lucky number.
Yeah, this has been such a great night connecting with President Robbins, Heather Carter, Abby, our second-year medical student. I'm so proud of her. And I would invite everybody, just to end it all tonight, to reach out to me. We would love to find out what, to help you meet your dreams and find out what works for you to support our tremendous programs that you've heard about tonight, or so many other programs that we can discuss personally. So now it is time for our last giveaway. It's a $250 gift card to Ocean 44, a beautiful fine dining restaurant near Scottsdale Fashion Square in Scottsdale. And that person is Mark Slater. So congratulations, Mark. And thank you so much for Ocean 44 for this wonderful donation.
Thank you, Liz, and congratulations, Dr. Slater. And thank you all for joining us. This has been a wonderful evening. We ask you, though, to mark your calendars because we have some more good things coming your way, including tomorrow. We ask you to join us for Wellness Wednesday. If you're having trouble sleeping in all these difficult times, be sure to tune in, Zoom in, register. The email is right there. Register for us. We start at noon tomorrow, and you'll get some great tips from Dr. Gradner there. We also like you to mark your calendars. We're going to be doing this again 1 week from today. We would like to invite you to take a virtual tour in Tucson of our new Health Sciences Innovation Building. You will be among the first to actually be able to comfortably from your chair go inside and see the building. You won't want to miss it. It's absolutely spectacular.
Yes, this has been great. This was a lot of fun. Thank you so much for joining us this evening. We, of course, say stay engaged, engage with us on social media. This event did not take place without the many, many hands virtually that have helped organize this event tonight. So we want to say very special thanks, of course, to Liz Kaplan and Caroline Berger, of course, and then Anne Marie Medina, Chris Dietrich, Seth Felkner, Aaron Sheets-Freiberger, Beth Smith, Adolfo Navarro, Adam Brooks, and so many more. Thank you all so much. We have an amazing team here at the University of Arizona. We couldn't do it without you. Have a wonderful rest of your evening. Stay safe and healthy, and bear down.
Thank you all.
Everyone thinks about tomorrow. But some of us live in a place that asks more. A place that pushes us to go further. That inspires us to keep searching for what lies ahead. So while others talk of a coming transformation, a new era, we know the future is already here. It's in our community, which is growing and diversifying. It's in our people who don't want to just live longer lives, but better ones. It drives our researchers who are transforming the human landscape. And it inspires our graduates who are emerging ready to build and lead a world of constant change. At the University of Arizona Health Sciences, we don't see tomorrow as something over the horizon. Tomorrow is here.